It has now been more than 6 months since the pandemic hit American shores, with the first cases of COVID-19 reported in the U.S. So we wanted to take a step back and examine how we got here through a rare joint conversation with some of the top health professionals in the country, 5 people who have run the CDC in the past 3 decades under both Republican and Democratic administrations.
The Centers for Disease Control and Prevention, based in Atlanta, is the nation's preeminent health protection agency. Its mission statement: to work 24/7 to protect America from health, safety, and security threats, both foreign and in the U.S. With an expansive team of scientists and medical experts, the CDC has helped the nation prepare for and weather public health crises for decades. But the novel coronavirus pandemic has presented a challenge unlike any the U.S. has recently faced. And critics say the CDC has failed to meet the moment, with its guidelines and recommendations often sidelined by the Trump administration's push to reopen the country as the pandemic grew. So what has the CDC gotten right? What could have been done better? And has politics taken over science in the public health response? 4 former heads of the CDC argued just that point in a recent op-ed in the Washington Post headlined, "We ran the CDC. No president ever politicized its science the way Trump has." They wrote, public health experts face 2 opponents, COVID-19, but also political leaders and others attempting to undermine the Centers for Disease Control and Prevention. Repeated efforts to subvert sound political health guidelines introduce chaos and uncertainty while unnecessarily putting lives at risk. So tonight we are joined by 5 former heads of the CDC. Dr. David Satcher, CDC Director and Surgeon General in the Clinton administration as the country faced the HIV/AIDS epidemic. He's the author of the new book, My Quest for Health Equity. Dr. Jeffrey Copeland, who served as CDC Director in both the Clinton and George W. Bush administrations, including the 2001 anthrax scare, and is now VP for Global Health at Emory University. Dr. Julie Gerberding also served as CDC Director in the Bush administration, responding to the bird flu threat and increased efforts to combat HIV globally. She's now an executive VP and chief patient officer at Merck, part of the Warp Speed program to produce a COVID-19 vaccine. Dr. Richard Besser served as acting CDC director in 2009 during the H1N1 swine flu pandemic, worked here at ABC News as chief health and medical editor, and now serves as president and CEO of the Robert Wood Johnson Foundation. And Dr. Tom Frieden served as CDC director throughout the Obama administration, including the fight against the Ebola and Zika outbreaks. He's now CEO of Resolve to Save Lives. Thank you all so much for joining us tonight. We look forward to your insights, and our goal is to essentially examine what went wrong, where things stand, and what comes next. So just for starters, just want to get everybody to weigh in on how we got to this moment. As you know, the U.S. now has the highest number of COVID-19 deaths in the world. In your opinion, what's the single biggest factor that led to this? And Dr. Satcher, we'll start with you.
I think the single biggest factor relates to leadership, because when we have trouble prioritizing the science and taking advantage of probably the best trained scientists in the world in terms of public health, epidemiology, etc., somebody has to prioritize the input of various people.
Well, I'd agree with David, certainly. We need to apply what we know. We need to feed truth back to the American public and to use those truths with our scientific evidence to control this disease.
I think that the clash of messages, when you don't see the political leadership supporting public health and letting people know that everything will be guided by the best public health science, you lose trust.
Trust and confidence. You know, we need to hear the science and the scientific experts, and we need to have the confidence that we're being led based on what is best for the public's health and not what's best for politics.
Absolutely. It's all about leadership, an organized response that outlines priorities, as Dr. Satcher said, that communicates effectively, as Drs. Gerberding and Besser said, that follows the science, as Dr. Copeland said, and that gives us the data. So we're all on the same page.
And now I'd like to do a lightning round here again with essentially just a one word or phrase as far as what you're most worried about in this moment now that we are here. And Dr. Frieden, I'll give that back to you.
I worry about getting too used to the horrible results we're getting. We are a global laggard, and we need to change our approach. We need to up our game and get ahead of the virus.
In the short run, I'm worried about immunity. We need a vaccine, and we need it fast. I think longer term, my biggest fear is that we won't learn our lesson and that we won't change our mindset about how important health security really is to our national security.
I worry about resignation, that people will be resigned to what we've seen in terms of response in this country so far and the trajectory of disease. What happens this fall, it depends on what we do now.
To remove partisan politics from having an effective response, this grouping of folks who believe in our mitigation efforts versus those that don't, dividing along political lines, makes no sense scientifically. The virus could care less.
Well, my worry is that as we come into this season, when we seem to be pretty close to having a vaccine, that we're going to miss some opportunities because of our failure to appropriately communicate, and in a way that gets back to leadership.
Dr. Besser, I want to quote the current head of the CDC at a press briefing at the White House on January 31st. He said, "This is a serious health situation in China, but I want to emphasize that the risk to the American public is low." And throughout January and February, the American people were given a sense by both the CDC and the Trump administration that this was under control. Where was the disconnect?
Well, early in a public health crisis, what you don't know far outstrips what you do know. Information very quickly started to come in that this would be a threat. And as soon as CDC stated that, CDC was sidelined and was no longer allowed to do the briefings. But if there'd been that ongoing dialogue and conversation with our public health leaders, it would be part of that journey.
Dr. Frieden, you look like you want to get in there.
If you go back to the record, on January 26th, Nancy Messonnier said, "We have to behave as if this is a pandemic." So it was already clear to the experts at CDC. On February 25th, she said, "Disruption to everyday life may be severe." Absolutely correct.
Dr. Gerberding, you recently wrote a report that was titled "Ending the Cycle of Crisis and Complacency in U.S. Global Health Security." And I just want to read a portion for a moment. When health crises strike and the American people grow alarmed, the U.S. government springs into action. But all too often, when the crisis fades and fear subsides, urgency morphs into complacency, investments dry up, attention shifts, and a false sense of security takes hold. Talk about that challenge of keeping the government in prep mode instead of being so reactionary.
We've all gone through the cycle of the crisis, the reactive investment, the incredible focus and attention for a short period of time, and then the absence of the sustained budget and support for really strengthening our public health system at the state and local level. That cycle has gone on for a long time, and I really do hope that finally it's gotten so bad that we will reinvent how we think about our health security in the context of our national security.
And Dr. Frieden, you were, of course, the CDC director during the Obama administration when a pandemic response office within the National Security Council was created to prepare for the next potential disease outbreak. The Trump administration disbanded that office. Do you think that we would still be in the same place today if that office were to still be operational?
Well, there's no question that drawing back not just from the National Security Council, but from the World Health Organization, from our engagement with countries all around the world, including China, did leave us open to a microbial sneak attack. We can't stick our head in the sand. We can't take our marbles and go home and leave the World Health Organization, shut things, and think it's not going to come back to haunt us. And that's what we're seeing right now.
Dr. Frieden, you were part of that joint op-ed that we mentioned earlier. How unprecedented is it to have the President of the United States regularly pushing back on the science and his own medical experts? And also, how dangerous is it?
I can't think of any precedent for this. It's one thing if the president were to decide, for example, no, we're not going to recommend masks. It would be wrong, but he could make that decision. But it's quite another thing at the same press conference where the CDC says everyone should wear a mask for the president to say, I'm not going to wear one. That is chaotic leadership, and that's led to far too much partisanship confusion, and a lot of spread of the virus. There is no enemy here other than the virus. We're all in it together.
If you think about where we are right now and the conversations going on about reopening schools, if you have politicians saying that CDC guidance is a barrier to getting children back into school instead of the roadmap for doing it safely, the whole system breaks down.
And you know, we've been talking about leadership. I just want to go through a few comments that the president has said.
I think it's under control. They are dying. That's true. And it is what it is.
Well, I think we're doing very well.
We got hit by a virus, and we've done a great job on that, but we don't get the credit.
Does anyone here on this panel agree with those statements made by the President of the United States?
It's not that we don't agree with it. It's every one of those falsehoods drives away our opportunity to improve our mitigation efforts. That counters and it causes confusion in everyone's mind. What's the right thing? And so a absolute in pandemics or in epidemics or in any public health activity is to ensure that the truth is being described to people, even if it's something that needs sugarcoating, or even it's something that seems bad news and people will be upset. The truth is what really counts. And once you lose that edge, then you're behind not just the virus, you're behind public opinion and people's behavior.
The only thing I would agree with there is that it is unbelievable. It's unbelievable that 6 months into the pandemic, it's not clear who's in charge federally. There's no plan. There's no common data that we're looking at to see what's happening with the virus and what's happening with our response.
The idea that we're doing all that we can when we are the wealthiest nation on the planet and we see countries all around the globe that have been able to take measures to get this under control in ways that we haven't even come close to. The idea that we should be complacent and satisfied with this current response and that this is the way forward until there is a vaccine or until there's been enough disease transmission that it starts to fade away. That is absolutely unacceptable.
Dr. Gerberding, if you were once again the head of the CDC and you were having a one-on-one conversation with President Trump in this moment, what would be the one thing that you feel needs to be done differently immediately?
It's communication, and what I would love to be able to do is to rewind the tape, because we do know some things for sure about this virus. We know it's incredibly transmissible, and we know that most people are still susceptible. We also know the 3 C's. It's crowding, it's confinement, and it's contact. If we avoid those 3 things, we have a really good chance of saving lives and slowing down the spread. As many of us have now said, it isn't rocket science.
Dr. Frieding, has the CDC effectively been muzzled to some extent, and has the CDC done enough to inform the country of the most pertinent information that we need to know?
Americans are voting with their clicks. There have been 1.6 billion clicks on the CDC website, and there's still a tremendous amount of accurate, timely, useful information recommendations there. The more we learn, the more we know, the better we can control it.
Dr. Satcher, your new book that's coming out in September addresses the decades-long racial inequities in healthcare, and the virus has exposed those even more. What needs to be done at this point to prioritize going forward so that minority communities don't have to face more dire outcomes?
That is a long-distance run. It's not going to happen overnight, but the problem is when the effort is not sustained. And I think that's a big problem that we face in this country. When the leadership is not consistent, the effort is not sustained, and we find ourselves still behind the 8 ball in terms of disparities in health.
No one in America should have to choose between putting food on the table and paying rent or doing things to protect themselves, their family, and their community. And for too many people in America, and a high proportion of Black and brown and Native Americans, so in the short run, we need to make sure that those protections are there, that people have income in their pockets, that we're providing protections for essential workers so that essential workers are not expendable workers. And then longer term, everyone in America should have the right to affordable, comprehensive health insurance and to sick leave and family medical leave and unemployment insurance. These are things that are not universally available, and they disproportionately impact people of color.
Dr. Gerberding, I want to look ahead to the prospects of a vaccine. Dr. Fauci and others have said that they believe that we can safely produce a vaccine by the end of the year, early 2021. Can this be done that quickly?
We all pray for a safe vaccine as quickly as possible that will truly help us end this pandemic. And I hope that we can go as fast as some people seem to think we can, but we can't take any safety shortcuts. This is one of those places where trust in the leadership and the communication about what's actually going on is especially important.
We all want the vaccine as soon as possible. But our experience with other vaccines it sometimes takes longer than we would have thought. Folks who are sitting watching this and saying, I'm not going to worry about it too much. When we get the vaccine in a couple of months, it's going to take care of it. And so I don't have to wear a mask. I don't have to distance myself from others. I don't have to not go to a bar or a restaurant like I used to. That's a real problem.
Kind of a jump ball here. Just want to get everybody to weigh in on the idea of if you are confident that we are going to be able to recover from this, and also what's your best piece of advice, lesson, I guess, for Americans going forward. Dr. Satcher, we'll start with you.
I think this pandemic is not something that's going to end abruptly. I agree that it's going to be with us. The problem is going to be with us for a while in terms of COVID-19. And we're going to have to really work together to get a vaccine. And then we have to deal with the fact that there's so many people who don't trust vaccines. Somebody needs to call attention to what we have to do together. And that's a level of leadership that for which there's no substitute. It's at the level of the president.
Dr. Copeland, can we recover?
Oh, we will recover. You look at 1918 and the disaster that struck then, and with less adequate science and a less robust nation triumphed and moved ahead and continued to improve everyone's lot. So I think there's every reason for us to be hopeful. If we could all just be pulling in the same direction, we would make considerable progress quickly.
I think the question that we have to ask is, what will that recovery look like? And who is going to bear the brunt of this going forward? If you look at who's been bearing the brunt of this pandemic disproportionately so far, it is communities of color. And as we go forward and we think about recovery from a health standpoint, recovery from an economic standpoint, different individuals, different communities are going to need different resources. And it's going to say a lot about us as a nation, whether we step up to this challenge and remove many of the structural barriers to health that people in this country face.
We'll recover, but the question is at what price and how long will it take? While we're maintaining our physical distance, we need to come together as communities, as health leaders, as nations around the world to really say we've got to work collaboratively in a committed manner to always stick together on the things that we know will help slow down the spread of this virus. That's a tall order in this very divided world, but it's about the pandemic. It's not about politics, and we really need to make that message number one.
The virus is here to stay for a while, vaccine or not, and it's going to bring significant changes to how we live, how we learn, how we work. But the one thing I hope we'll get out of this that's positive is to make sure that we are never again this underprepared. And we have to focus on strengthening the system at the federal level, state level, city and county level, and the global level. That's how we can all be safer. That will save lives.
Doctors, I thank you so much for your time. Really invaluable insight. We really appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.